Welcome to Everyday Nursing Knowledge Lectures, and today we'll see different lists or different groups of antihypertensive drugs. So here are the letters A to D, and A stands for different or for types of antihypertensive groups, B for beta blockers, C calcium channel blockers, and D for diuretics. There are other groups, example vasodilators, and you can remember the letter D to remember vasodilators. Now, the first letter A, angiotensin converting enzyme inhibitor or ACE inhibitors. And these medicines end with the suffix or the word pril, example Lisinopril, Captopril. Second is ARBs, that is angiotensin 2 receptor blockers, and ends with the word sartan, example losartan potassium, valsartan. Alpha blockers ends with the word ozin or zosyn, example doxazosine and prazosin. Alpha 2 receptor agonist. The first two groups are more commonly or widely used as antihypertensive than the rest two. Now the letter B stands for beta blockers, end with the word or letter LOL, example metoprolol, carvedilol. C for calcium channel blockers, example dipine or dipine, example amlodipine, nicardipine or nifedipine. Diuretics ends with the word ide, example furosemide, bumetanide. Now the effects we will discuss as we see the actions of each groups. So the first is angiotensin converting enzyme inhibitors or ACE inhibitors. So the action is that it inhibit ACE or angiotensin converting enzyme. So the angiotensin converting enzyme convert angiotensin 1 to angiotensin 2. Angiotensin 2 in our body it is a vasoconstrictor. It constricts the blood vessels and it increases sodium water reabsorption. So when you're blocking the ACE, angiotensin 1 cannot convert into angiotensin 2. As a result, blood vessels dilate and there is decreased sodium water reabsorption. Now the blood pressure is equal to cardiac output into systemic vascular resistance. Cardiac output is the amount of blood pumped by the heart in 1 minute. And you get cardiac output by multiplying heart rate into stroke volume. Stroke volume is the amount of blood pumped by the heart in one or in each stroke or with each beat. So when the blood vessels dilate, there is a drop in the systemic vascular resistance. And when there is a decreased sodium water reabsorption, the blood volume or the stroke volume or the plasma volume decreases. As a result, so there is a drop in the systemic vascular resistance, drop in the stroke volume. As a result, blood pressure drops. It ends with the word pril, example lisinopril, enalapril, ramipril, captopril, and these are the trade names. So the next group is angiotensin 2 receptor blockers or ARBs. So it blocks the ARBs. That means it blocks angiotensin 2 receptor sites. So angiotensin 1 get converted to angiotensin 2 and it binds to certain tissues or sites called angiotensin receptors. So when you're blocking the ARBs or when you're blocking the angiotensin 2 receptors, the 2 cannot bind to the tissues or cells. So again, angiotensin 2 is a vasoconstrictor and it increases the sodium water reabsorption. But now it cannot bind to the tissues or to the cells. As a result, again, blood vessels dilate, decrease sodium water reabsorption. So when the blood vessels dilate, systemic vascular resistance drops or falls. When there's a decreased sodium water reabsorption, the plasma volume of the blood decreases. As a result, stroke volume decreases. As a result, the blood pressure drops. Now the example, sartan, losartan potassium, valsartan, and these are the trade names. The third group is alpha blockers. So it blocks the alpha receptors. There are different types of alpha receptors, that is alpha 1 and alpha 1 and 2. So when it acts on the alpha 1 receptors, it's called selective. And when it acts on alpha 1 and 2 receptors, it's called non-selective. So there are alpha receptors in the blood vessels and these are associated with increase in blood pressure. It has a sympathetic effect. It increases the blood pressure. So when you're blocking the alpha receptors, the blood vessels dilate. Again, blood vessels dilate, systemic vascular resistance decreases. As a result, blood pressure drops. So selective alpha 1 blockers include doxazosine, prazosin, terazosin, whereas non-selective blockers, mine, include phentolamine and phenoxybenzamine. These medicines are mainly used to treat hypertension associated with pheochromocytoma, that is a tumor, benign tumor in the adrenal glands. Now the fourth group is alpha 2 receptor agonist. So again, there are different types of alpha receptors, alpha 1 and alpha 2. Alpha 1 increases the blood pressure, whereas alpha 2, it decreases, it inhibits sympathetic activity. The alpha receptors, 2 receptors, are found in the central nervous system. It decreases the sympathetic activity. So when you're activating alpha 2 receptors, it inhibits sympathetic activity. As a result, heart rate drops and the blood pressure drops. And examples are clonidine and methyl dopa. So now let's move to the letter B. So B stands for beta blockers and it ends with the word LOL. Again, there are different types of beta receptors, beta 1, beta 2 and beta 3. Beta 1 are found in heart, whereas beta 2 found in smooth muscles, example lungs, blood vessels, etc. So when the beta blockers blocks the beta receptors in the heart, it's called selective or cardioselective. And when it blocks, it decreases the heart rate. Beta receptors are associated with increasing the heart rate, same as alpha 1 receptors. So when you're blocking beta 1 receptors in the heart rate decreases, contractility decreases. As a result, you can see the heart rate drops, stroke volume drops, decrease in the heart rate. As a result, blood pressure drop. Again, the non-selective means it acts on both beta 1 and beta 2. As a result, again, the heart rate drops, beta 2 in the blood vessels. So the blood vessels dilate, again, blood vessel dilation, blood pressure drops. Some of the examples for selective beta blockers are acebutolol, atenolol, betaxolol, bisoprolol, esmolol, metoprolol. And few examples for non-selective beta blockers are carvedilol, labetalol, nadolol, propranolol, sotalol, and timolol. Now let's move to another letter or next letter, C. C stands for calcium channel blockers. It ends with the word dipene or dipene. So it inhibits the calcium channel entering the heart and the blood vessels. So when the calcium channel are blocked or calcium channel cannot enter the heart, there is decreased heart rate, decreased contractility. And when the calcium cannot enter the blood vessels dilate. So it blocks the calcium channel from entering the arteries. When it's blocked, vasodilation happens. When the calcium channels are blocked in the heart, it causes decreased heart rate and contractility. Again, calcium channel blockers which acts on the blood vessels are called dihydropyridines. Example, amlodipine, nifedipine, nicardipine, and nimodipine. Now, the calcium channel blockers that acts on the heart are called non-hydropyridines. Example, diltiazem and verapamil. So it acts mainly on the heart and decreases the heart rate and contractility. As a result, these group of drugs, diltiazem and verapamil, are used to treat tachydysarrhythmias. Now, moving to the last letter D, diuretics. It ends with the word "ide." So it facilitates the diuresis. That means it increases the urine output. So the diuretic groups acts on different parts of the nephron. It increases the urine output, decreases reabsorption of sodium and water. Here is the example for few or different types of diuretics. Loop diuretics. It acts on Henry of loop. An example, furosemide, Lasix, or bumetanide BMX. Potassium-sparing diuretics. Example, spironolactone. Next is thiazide diuretics. Example, hydrochlorothiazide. So today we saw a different list or different groups of antihypertensive drugs, and thanks for watching my video.